too much. Hi, welcome to our holistic ear cleaning salon. How can I assist you today? Oh, I'm so sorry to hear that you're having trouble with your ears. You have a chronic problem with your ears. Okay, overproduction of earwax. Well, yeah, that is a pretty common symptom that we have here in our clinic, that a lot of our clients come seeking, most of all, relief from this particular problem that can be very, very annoying for you. So don't worry, you're in the right hands. Let me just start by prepping up myself. I will have to do an examination of your ears, and from there we're gonna work on a special blend of herbs to create an ear cleaning solution and oils that is gonna help soothe and clean your ears completely. Also, we are not a medical facility. We are a salon that helps you soothe your symptoms, give you a relief of the problem that you're currently having, but in no way we are gonna remove the problem completely, the underlying problem. So I just want you to be aware of that. Okay, very well. So let me start by checking your ears. I'm a medical practitioner, so I have training on medical ear examination. We'll be using this otoscope to check on inside your ears, okay? Is it okay if I go near you? Thank you. Very well. So let's start here. I see a lot of redness in the outer side part of your ear canal. Do you scratch your ears a lot? It gets itchy sometimes. Okay, so let me start by going into your ear canal here. Well, I do see that your problem with overproduction of earwax is pretty severe. It's also impacted on certain areas, which means it's almost rock solid. But don't worry, we have a special blend of herbs that is gonna help you with this problem, especially with the issues that you're telling us. Okay, good. Let me inspect the other ear. This ear looks like it's also have the similar problem. Do you have any discomfort while I'm inspecting your ears? When I put the otoscope inside? The itchiness mostly? A burning sensation too? Okay. Yeah, you do have a severe problem here. I'm gonna do a little test here. I'm gonna be inserting this into your ear just to make sure how the earwax is looking up there, okay? I'm gonna ask you not to move while I'm doing this. Okay, want to see the consistency. Feel the area. Okay. Here we go. Good. Very good. You're doing great. Excellent. Yeah, it's pretty hard in there. Let's check this area. Okay. Very good. Yeah, so the consistency is the same as in your other ear. Almost as a rock. No wonder you're experiencing itchiness and a burning sensation. So sorry for that. Okay. Well, with what I have seen into your ears, your problem is very chronic, as you were describing before. I would like to go with 2 treatments. One with the herbal oil solution that we are going to create just for you, and also with a steam therapy for your ears. What we are going to be doing is put 2 cups in both ears, and we're going to be putting warm distilled oil water with herbs such as this one, and with the warm mist that is going to be created, it's going to help loosen up the rock solid earwax that is currently in your ears, and it's also going to help soothe the area and feel very, very good on you. Okay, so what we're going to do first is go with the mist, because as I was saying, it's pretty hard in there, and then we're going to work with the herbs. Okay, let's start by prepping you up. I'm going to put a little cap on your face. Okay, let me just put this here. There we go. And I'm also going to protect your clothing. It can be a little bit wet with the steam. There we go. And I'm going to be putting the covers in your ears. We're going to do this treatment for around 5 minutes. There we go. Okay. Let me just connect this to our mist right here. Now, during this treatment, you're going to start hearing very soft sounds of boiling water bubbling, and also you're going to feel the mist into your ears. It's going to be also very, very wet on the area. That's why I put a cover in your clothing, and it's going to feel warm. It shouldn't be feeling hot or any burning sensation at all. If you feel that it's a bit too hot for you, let me know immediately, okay? Okay, this is ready. We're gonna start with this while I prepare and start gathering the herbs for your blend. Okay? There we go. You ready? Excellent. Let's just connect this here. For you, we're gonna go with level 2. 1, 2, And we're starting. Okay, I'm gonna be back in a little bit with your herbs. Excuse me. Okay, I'm gonna remove this, turn it off. There we go. And I'm gonna remove the caps. Good. Let me just wipe the area. It's pretty wet. There we go. How are you feeling? Good? Nice. Yeah, it's very soothing. It also helps with the ear cleaning part because it kind of numbs the area, so it feels good, especially with your problem that your ears are very sensitive. There we go. A little bit right here. Okay, so we're gonna start with your blend. We are gonna be using Cortolovo flower, which is a Mexican herb that we use to soothe the ears, and it also has an astringent component to it that helps remove any bacteria that could be there, and a very beautiful aroma. Okay, we will be using 2 parts. Should be enough for you. In this case, we're gonna do the blend in a very oily way. This way it's easier to work in the ears. We're also going to be using this blend here of herbs. This one allows us to soothe the area, clean the ear completely, and remove the redness present because of the scratching. In this case, we're going to go with 3 parts. 1, 2, and 3. This blend is completely personalized, and you're gonna be taking home a droplet with it, so you can use it at home. Yeah, no, this is not a medicine. It's not made to take place of any medication that your doctor has prescribed. This is just a little help for you. If you're with medication at the moment, you should continue using it. Let's place the blend here. We're going to be using a blend of our special oils created here in our clinic. Let's go with lemongrass too. Just 1 part of it. Such a great aroma, isn't it? One of my clients' favorites. Now we just need to mix it well. This is the droplet that you're going to be taking home too. Okay. Let's do first a little allergy testing. I'm going to ask you to see your arm. Normally this doesn't have any reaction, but every person is different, so we make sure that there is no allergic reaction to the herbs. Okay, I'm gonna clean your hands with this, the arm area. Good. And a little bit of rubbing alcohol. And we're gonna wipe it. Good. Now your arm. Let's do the little test. Just place your arm like that. Thank you. Good. Just gonna wipe it a little bit to your skin. There we go. We're just gonna wait a couple of minutes, okay, to see if there is any reaction. Let's prepare the tools for your ear cleaning. If you start noticing any reaction, like burning sensation, itchiness, let me know. You're okay? Very well. So we're gonna go with the traditional ear cleaning tool, which is this one, that allows us to remove most of the earwax trapped in your ear canal. We are also going to be using our specialized tool here, tweezers for the larger chunks that we might encounter, and a scraping tool for it. Okay, let's see your arm. Okay, you're good to go. No allergic reactions. Now let me inspect your ears again. See my otoscope. Okay. Yeah, they seem prepared. And this side looks good too. Excellent. Okay, ears are ready. Let's start with the application of your herbs. Now I'm going to ask you to be very still while I'm doing this. Okay, just like that. You're doing great. Very well. Now the other ear. Excellent. Well, let me press your ears here for just a little bit so the oils don't escape the area. You're doing a great job. Good. So during my ear cleaning, I'm gonna lay you down here in the camera. So I'm just gonna ask you to try not to move. If you need to cough or sneeze, try to hold it or let me know so I can remove the tools from your ears. If you need anything else, just nudge me a little bit or let me know. Okay? It's okay to fall asleep. Most of my clients fall asleep during this time, and I'm gonna try to be quiet for your relaxation and so I can concentrate better. Okay? Very good. Let's start just by cleaning the outer part here before I lay you down. There we go. Okay, let's start with the first part of your cleaning. Just stay in that position. I'm gonna start by scrubbing the area, okay? Okay, I'm gonna lie you down now. So you're gonna be facing the ceiling. Okay? Okay, here we go. Okay, so now this is the most delicate part of your ear cleaning. Now I'm gonna ask you to be very, very still, trying not to move. If you need to move your head, let me know so I can extract the tools from your ears. Okay? So you're ready? Very well, so let's continue. Okay, I'm sorry to wake you up. Just gonna put your chair in the front position again. There we go. How are you feeling? Good. Well, I'm glad to hear that. That's our main goal, for you to feel good, to feel better with your ear problem. Now, there was a lot of earwax buildup in your ears, as you were saying. I was able to remove and extract everything there. There was some redness present there too, but I'm guessing that you're taking care of that with your doctor. Now, the drops that you're gonna be taking home, which are the same that you're having here, are just a soothing oil for you blend that is gonna help you feel good in your ears. Let's say that you're feeling itchy inside your ears. You're gonna be putting just one drop in each ear and try to do this on circular movements as I was doing it before. This is gonna help soothe the area, make it feel less itchy, and just calm the area, not to feel that burning sensation. But as always, it's very important to continue your treatment with your doctor that I'm sure that you're having right now, correct? Very well. So what I'm gonna be doing now is write you a note, or so to say. This is with the blend that I was using on you in case that your doctor requires it. Most of our clients go to doctors that require a note with the ingredients that we use, which is what I'm gonna be doing here, with exact quantities and weight of each item that I use, and a description of exactly what we did today. This way your doctor is gonna know what we did, what we use, in case that they need to know. And also I'm gonna be putting an instruction for your drops. Okay, so that should be all in case you have any other questions. Well, you can use the drops whenever you feel like it. There is not a stopping period. You can use it even if you don't have an ear problem. It works great just to sit in the ear if it feels itchy or a little bit dry. It works wonders for that. You would like to take another appointment? Oh, excellent, of course. For the same service, since you have the problem. Okay. Normally, I like to book my clients 4 to 6 weeks after their first treatment. You would like that? Okay. Okay, so I have you booked for the next 6th week, and we're gonna do another inspection and see if you need another blend, or we continue with the same one. Okay? Well, it was a complete pleasure working with you. Let me just remove this and the clothing cover. If there is anything else I can do for you, well, it was a pleasure. Please take care, and I will see you in 6 weeks. Of course. Goodbye. Having a good day. I see, I see. Well, it is what it is, isn't it? We all have those days. So tell me, what are you in for today? Okay. Yeah, I'm seeing here your shirt. Interesting. You have a quite long medical history with your ears, and seems that it's completely chronic for you. You have tried any treatment that you can find, right? Oh, I'm so sorry to hear that. Yeah, it can be very, very frustrating when we have a condition and we just don't find a solution or anyone can tell us what to do. So they have been treating you with several type of drops and treatments for your ears. None of them have been helping you with the issue at hand. I see here that you also had an experimental treatment a few months ago. Yeah? How did it go? Did you felt any improvement? Mostly the same? Okay. So I'm guessing that you are here just for a regular cleanup. Yeah, since our clinic that is the only thing that it specializes on. Yeah? Okay. Yeah, actually here we do a full cleanup and treatment, especially for people that have your issue, maybe not as bad as yours, that is completely chronic, but we help alleviate the maybe not damage, but the frustration that you have with your ears. So what we're going to be doing first is a complete examination of your ear canals. Then we are going to determine what's the best course of action for your issue in particular, because I just so here all the treatment that they have tried on you, none of them have worked, but this is mostly just as maintenance, right? Yeah, sometimes in some places they just give you medication to go by and don't really treat the root of the issue, and it's very frustrating. I'm so sorry that you're going through this, but today we're gonna be making you feel better. Okay, let me just see here and let me know. Okay, when was the last time that you have an ear cleaning, a complete ear cleaning? Okay, about 3 weeks ago. Okay, just one moment please. Hello again. I was calling our nurse so they can prepare your ear cleaning treatment. Normally we go with a basic one, and when I do your examination we take whatever we're going to be using on you. Okay. Just trying to make sense of what is in your medical history. Is as I'm seeing 5 years of issues with you. Oh, it's gonna be 7 years. Well, yeah, it's quite a lot to just follow through, but worry not. Let's start by examining your ears. Okay, so I'm pretty sure that you're already familiar with our tools. Yeah, let's start with this one, the basic one. Okay, now try not to move. Okay. Well, I was seeing in your medical history that you had issues with impacted earwax. Right now I don't see anything like that. Ear wells are open. Let me just use something different here. Let's try the smaller one. Okay. Yeah, this one has a better light and allows me to see all the ear canal. Yeah. Well, it's not impacted per se. Your ear walls seem a bit inflamed, actually. I don't like how it looks. Let me check the other ear. Okay, this one is impacted. Yeah. There's something in there covering the entrance. Let's use the big guns. Okay, with this I'm gonna go a little bit deeper. I feel a little bit uncomfortable, but please bear with me while I'm doing this. Okay. Yeah. Okay. Yeah, right now there is an inflammation present and redness too. That tells us that there may be an infection present in your ear canal. So we're going to have to be very delicate on how you treat your ears this time. Okay. I'm going to have to use medication irrigation. It's going to soothe the area. We don't want to irritate the ear walls more with the scraping, so we're going to have to treat first the infection and redness present. It doesn't look that bad, but it's not optimal to have your ears this way. Well, let's see the other otoscope here. Okay. Let me just call my nurse again. Karen, can you come please? Thank you. So we have an infection present in the ears. So we're going to have to go very, very gently with it. So get the kit number 5 for our patient. And also kit number 2, we're going to be using the medicated irrigation treatment. Okay, just put it here so you can get everything ready for the cleanup. Yeah, thank you so much, Karen. Very well. Okay, I believe that this is the first time that an infection is present with you when you're trying to do an ear cleaning, right? Yeah, I don't see anything in your medical history about ear infection. Is there any difference that you have been doing lately? Maybe you went to swim to a lake, a river, the ocean, to a pool? Okay. So let me tell you what we are going to be doing today. First, we have to treat the infection that you have. It's very mild, but I don't like ears to be red and swollen while we do an ear cleanup. So we're going to be treating that first. For that, we're going to be doing an irrigation treatment, which means that there is water that is going to be pouring into your ears with medication that is going to help your ear canal to soothe. It's not going to remove most of the earwax because with you it's very chronic. So for that, we're going to have to go in manual to take it off and scrap it off. So with this, we are going to help the ear loosen up and help with the redness present and the inflammation. That we're going to take care of that first. Okay. It's a very relaxing process. It feels great. Most of our clients and our patients fall asleep during the treatment. For you, with how your ears look, I would say 5 to 7 minutes would be a good amount of time for that. And then if it looks good, we're gonna go in and start the ear cleaning process that you already know. Okay. Yeah, right. Thank you. Very well. So let's set you up. You're gonna be putting a cover into your ears, like earphones, where the stream of water is gonna be gushing in. You know what? Let me just protect your clothes because it might splash a bit. Let's put your hair to the back too. Like that. Good. And we're going to be covering this part, okay? Let me know if you're comfortable like this. Good. Excellent. So let's start by covering your ears. Needs to be a little bit tight. It takes a bit to just set it up. Go. When you're ready, now let me know if it's too tight. It shouldn't feel loose, but not too tight that it's bothering you. Feels good like that. Very good. Now, let me just put it into place like so. Good. Now I have two options for you during this treatment. As I was saying, it's very relaxing and quite nice, to be honest. And we have the option to have a face cover or night cover for your relaxation, or just leave your eyes like this and you can browse through your phone or magazine, whatever you like. Okay, very well. Let me just set you up with a. Do you have any preference between eye masks? We have a darkening mask and a gel mask. The gel mask is quite relaxing. Okay, gonna go with the gel mask. Very well. Just gonna set it up. Are you comfortable like this? I can loosen it up a bit. You okay? Excellent. So let's start with this. Let me just charge up our machine here. May take a little bit to start working. There we go. Excellent. So you're gonna start feeling the water rushing in through your ears. It's gonna feel quite nice. So we're gonna set the timer for 5 minutes. I'm gonna come check you out, and if it needs a little bit more, we're gonna set it for 2 more minutes. Okay? Anything else that I can do for you while you wait? Okay, so I'll be here. Let me know. Okay, let's check you up. I think we're gonna be going for 2 more minutes. It will be better. Okay, good. Very well, so I'm gonna remove the eye mask, turning off the machine. How did it go? Yeah, quite nice, huh? Yeah, it's patient's favorite. There we go. Take this off here. Let's inspect your ears again to see if our nurse can do your ear cleaning, okay? Let's start with the little one, the entrance, okay? Okay, looks much better. Much better. This side. Beautiful. Okay. So we're gonna have to put this in your medical history that you suffered of an ear infection. You didn't have any pain whatsoever? Nothing? That's pretty uncommon. So we wanna let this show on your record. So in the future, if another medical practitioner asks you, tell them that you had an ear infection, okay? It's very important for your chronic disease. So I'm gonna have our nurse perform your ear cleaning. She has a very gentle hand. She's quite good with it. You're gonna really enjoy it. Nurse, yeah, you can start doing it. So she's gonna be working side by side for you, and remember, just try not to move or talk during the process. I'm gonna be taking a few notes about your medical history too, so I can add it to your record in your archive, and we'll see what else we can take you home with that is going to help you soothe, especially for the infection that you had, okay? Now in your case right now there is some impacted earwax here and there, so yeah, we're going to be using the scraping tools. Yeah, it's quite a lot, so be just extra gentle and try to use some maybe some bubbles. It's gonna help too, just to soothe the area. Okay, you're gonna love the bubbles. It's quite nice. So if you need anything, just raise your hand so the nurse can take the tools off. Okay, very well, you can start now. So I'm gonna have to add this to your medical history in the computer, and also gonna check what we can give you for your problem that doesn't interfere with the treatments that you've had before. Don't worry, you don't need to respond. I'm just telling you what I'm gonna be doing right now. Okay, I'm gonna be back in a bit. I'm gonna be transcribing your medical history into the computer and bring the medication that you're gonna be taking home, okay? So I leave you in good hands here with our nurse, okay? I'll be back in a bit. How did it go? Good. Thank you so much. Nothing out of the usual? Okay, excellent. So there was nothing out of the usual, just the lingering ear infection that you're going to be taking home with these drops. You're going to be applying just one drop on each ear at night before going to bed for the next 7 days. Okay, so I'm going to give you this, and it's going to be in the reception with our nurse, and your prescription is going to be there with the instructions. Anything else that I can do for you today? Well, it was my pleasure. Let me just take this off for you. And if you need anything else, please let us know. And I hope that you enjoy your cleaning today. Of course, please take care, and anything else that you need, you can feel free to call us. Goodbye. How are you doing? Thank you so much for coming to our clinic. I see that you're having some issues to sleep. So sorry about that. I know how hard it can be, and it really disrupts our life when we cannot sleep accordingly to our hours. But today we're going to help you with that. And the treatment that we're offering today is an ear cleaning with acupuncture that helps us press certain points in our ears that, let me show you here, that will allow us to give us relaxation, help us feel more calm and ready to sleep appropriately. So this is your ear, and we're going to be pressing certain points. In your case, since your problem is that you cannot fall asleep or you cannot stay asleep during the night, we're going to be pressing the points right here on this area, along with an ear cleaning inside your ear canal. This is going to serve two purposes: to clean your ears and give you relaxation. I don't know if you have ever heard about the Japanese and Chinese ear cleaning techniques. Not so much? Well, in those countries they have this art to clean the ears, not just for health or mere cleanliness. It's more for relaxation, to make us feel calm, good, and relaxed. They use tools such as this one, which is a bamboo stick with a little curvature at the end to scrub the ear, and at the top it has a little fluff feather that suits the ear. That's why we created this service here, to give you that same relaxation, and with the Chinese too, pressing points to help you sleep. Now this doesn't work immediately. It takes around 3 sessions for it to completely work, but after the first session you're gonna start feeling already calm, and maybe not put you to sleep right away, but it's gonna help you stay feeling better and maybe having a better good night's sleep. Well, the first step will be checking your ears to see if there are any medical issues that we are not able to treat. If your ears are in good shape, we are going to be able to go ahead with the treatment. I'm a certified nurse, so I can do this kind of exams very well. I will be using an otoscope. I don't know if you know this tool. I'm going to show you in a minute. I will be inserting this into your ear canal to examine them. There's a little light here. Very good. I'm going to be very close to you. Is that okay? Thank you. Okay. So there is a wall here, an earwax buildup, what it's called. Doesn't seem to be any other issues besides the clogging. Okay, let's check the other one. Good. Okay, it's also clogged. But that is pretty normal in some persons. There is overproduction and it creates these walls of earwax. It's going to be pretty easy to remove. We're going to start first by softening up this ear wall of earwax, and then move our way inside. I'm going to set up some drops inside your ears to start softening the earwax. Okay, should be enough. I'm going to press for a minute to help the drops go where we want them to go. There we go. Is it bothering you? You're okay? Very well. I'm going to put a little bit of steam into it. I will protect your clothes with a towel here. Because it might get a little bit wet. I don't want it to be dripping into your clothes. Also protecting your hair. Good. There we go. Now it might feel a little bit cold, that is okay. Oops. Just fill this up. Getting a little bit trickier here. There we go. Okay, you ready? It's a little bit cold, right? But it does feel nice. Okay. Need to be a little bit closer. Okay, here we go. Nice. It's dripping a bit. There we go. Very good. Now I'm going to be giving a little massage into the area to press these points that I was telling you about. You can close your eyes if you wish. Might tickle a little bit. That is part of the treatment. Also relaxation. Don't worry if during the treatment you close your eyes, doze off away. That is completely fine. When the time comes for the ear cleaning, which is gonna be going inside your ear canal, that's when I'm gonna ask you to try to not fall asleep too much. Well, most of my clients fall asleep during that part, which is good because of the insomnia that you're feeling. Let's check again. Hopefully the earwax buildup is softened up and we can remove the wall. Okay. Let's checking here. Much better. Much better. Okay, let me get another tool. 1 second. There we go. Okay, continuing this area. Gonna remove the towel now. This side is starting to be free. That's good. This here is a little bit tougher. Check with the otoscope again. Very good. Okay, ear walls look healthy. There's some earwax here and there, but nothing out of the ordinary. That's good. Very good. This one here also looks good. We are going to be able to perform the treatment at full. That's pretty good. Start with the pressure points. We're going to be using these bamboo take kind of like a pencil where we're going to be pressing these points. You ready? Okay. Good. 5, 4, 3, 2, 1. Release. 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 Other side. 5, 4, 3, 2, 1. Release. 5, 4, 3, 2, 1. Release. Okay. Now during this part, we're going to be using our fluff. Might be a little bit tingly. If it's too much for you, let me know. Doing great. If you feel that it's too much, you can really let me know. You can go a little bit slower. Our next cream here. It's gonna feel very warm in the external ear. out. Feel your eyes heavy. Feel free to close them and sleep. You're in a safe space. Very well. Now it's time to go inside your ear canal and do the internal cleanup. During this time, I'm going to recline you. You're going to be looking up. You can fall asleep. You can set up your pillow so it doesn't move your head. But it's very important that if you need to cough or sneeze, to let me know so I can remove the tools. Okay? Very well. So let me just move your chair. You're going to be looking outside. Okay? Okay. You're all set up. Are you comfortable in this position? Do you want me to recline you more, give you a different pillow, or are you okay with this one? Comfortable? Very well. So what we're going to be doing now is cleaning your ears completely, but in a very soft way. We're going to be scrubbing, scratching, and mostly giving you a relaxing time for your ears. It's completely safe to fall asleep. I will be taking care of you. But if at any moment you feel the need to sneeze or cough, as I was telling you before, please let me know. Okay? Are you ready? Very well. During this, I won't be talking, so you can relax and I can concentrate better on your ears. Is that okay? Excellent. Okay, we are ready to start. You enjoy. so sorry to wake you up. You look so peaceful while sleeping. I'm gonna remove this. Okay, I'm gonna have to put you in the correct position. Well, I'm very happy to inform you that your ears are completely clean. Didn't find any issues in your ear canal or your eardrum, which is great. I noticed that you fall asleep while we were doing the cleanup. That is completely okay, don't worry. Now, I'm gonna be leaving you here for at least 10 minutes. You have the room for 10 more minutes. Oh, I'm so sorry, 15 more minutes. So you can recover, feel yourself again, because if you stand up right now, you might feel a bit dizzy from the massage and the ear cleaning. So I suggest you to stay this 15 minutes in this position, or you can recline again and just try to not fall asleep again, but recover your strength or walk slowly. But take your time, because if you do it too fast, you will feel dizzy and it's not gonna be a very comfortable sensation. Now we can do your appointment for the next 2 sessions for this. Yeah, it could be every week. It's not possible to do it on the next day. It doesn't work that way. Yeah, okay. Are you fine on the same day, same hours? Good. Okay. I will set you up at that time. The same hour. And it's gonna be the same on the week before that, after that. Very well, so that will be all for me. I hope that you enjoyed this time with me, and I will see you next week, and hopefully tonight you're gonna have a good night's sleep. Oh, another thing, if you could log your nights for the next week, if you were able to sleep, if you woke up at night, that way we will know if we're progressing and if it's helping. Very well, I will see you next week. Please take care and stay safe. Bye bye. I'll be outside whenever you're ready. I will be waiting for you. Excuse me. How are you doing? Yes, of course, we take in walk-ins. Okay. Looking for an ear cleaning? Do we have any issues? Okay, tell me about it. Feeling a bit dizzy, kind of like muted sounds, like baffled. Okay, yeah, I get it. Yeah, of course, we have an opening. Actually, you are in luck. Our appointment of this hour canceled on us, so we have an opening. Can I have your name so we can have you in our system? Okay, I'm gonna need your full name, and also if you can provide me of your insurance information, please. Okay, thank you. Let me just put it through in our system. It's your first time in our clinic, right? Yeah. Normally we have a lot of regulars here, and your face doesn't seem too familiar. Yeah, that is actually what we specialize in. Ear cleaning, ear problems. Okay. Now, if I can have a phone number, contact information, email. Okay. Thank you. Very good. So, please take a seat. Make yourself comfortable. Let me prepare myself. And when did you start noticing these issues? Okay, so it's been a bit, right? How do you normally clean your ears on a regular basis? Yeah, no cotton swabs inside the ears. Our golden rule here, very important. Any other symptom that maybe has been bothering you? Like a ringing sound? Is it constant? Okay, that could be tinnitus. This is something that happens when we use headphones, the ones that go inside earbuds, and we put on music a bit loud or audios. Sometimes when we go to concerts too, we can develop some tinnitus issues. Normally doesn't have anything to do with earwax problems. It's mostly because maybe we have abuse or we have been in places that are too loud, and this affect our ears, creating this tinnitus. From certain people it tends to go away, to others it becomes chronic, that it stays with you mostly all your life. And for this kind of people, they tend to get used to it, but at sometimes when they are very stressed or maybe tired, they tend to notice that ringing sound way more than you normally do it on a regular basis. Have you been under some stress lately? Yeah, your issue with your ears. It's been stressing you out. Okay, don't worry. We're gonna help you. I'm gonna start by checking your ears with my otoscope here. Is that okay if I'm getting close to you? Thank you. So yeah, normally when we are under a lot of stress, the problems with tinnitus tend to get more chronic or more noticeable, even though it's mostly the same, but it tends to get stronger during those times. Okay. The earwax doesn't seem impacted, but you do have quite a lot. Let's check here. And same issue here. Okay, the good thing is that it's not impacted, which means that the earwax is rock solid, which tends to be harder to remove and from times a little bit uncomfortable, so that's good. It's mostly soft earwax, which is gonna be easier to remove. There is some stuck in your ear walls. Those tend to be a little bit tricky, so we are gonna be using certain tools that I'm gonna show you in a minute. These tools are specialized for this type of issues. Now you can see that it comes in different type of sizes and shapes, so depending on the type of earwax that you have, we use it. And also for relaxation, in your case we're going to be doing a lot of scraping because it tends to get stuck into the ear canal. Okay, let's start by applying some of our special solution. This special solution allows us to remove the earwax in a more easier way, and it prevents any discomfort. It has an agent that tends to kind of numb the area, but not completely, so when we do the ear scraping, it doesn't bother you. Okay, I'm gonna be applying it generously in each ear. Okay, try not to move. Gonna press a bit into your ear. Okay. Good. Now let's try here. We're going to protect your clothes from any fallouts. There we go. Okay, we're going to leave it there for a couple of minutes while I update your information here, okay? So when did you start noticing the ringing sounds in your ears? Okay. Do you normally work in a very loud area, or does your job includes going to these kind of places, or are in these kind of places, construction sites, concerts of sorts? Okay. There are some persons that tend to be more sensitive to sounds than others, especially for people that maybe tend to be a little bit introverted, that like to spend more time on their own or at home, and when they go out they are exposed to noises, to loud noises. They tend to get these issues more. Not that I'm saying that introverts tend to get more tinnitus, but in some cases it happens because they are not used to loud sounds, and for other people it's because of their line of work or their maybe abuse of earbuds and music, and maybe a podcast. They tend to listen at loud sounds. Yeah, it's kind of not hard to pinpoint what's the cause, but well, in my case, the reason that I have tinnitus is because of earbuds. I used to blast music up and up and up. Yeah, and I developed this tinnitus. Yeah, you get used to it, sadly, but it does get bad when you get stressed. Okay, let's check out your ears again. Okay, it looks nice. Nice and soften up. Let me just try here. Okay, good. Now sometimes the muted sounds that you're describing is because the earwax is completely blocking your eardrum. Maybe the layer of earwax that you have is too thick. Even though that is soft, it might be too thick, that is preventing sound to coming inside on a proper way. Okay. Let's see if they are ready. Okay. I'm going to start by just doing the external part so we can open our way to the inner part of your ear. Okay. Now let's try to move here too much. Okay. No. Well, we're gonna have to definitely do it in Another way. Okay, let me try this. Let's apply this other serum. I want it to be as comfortable as possible for you. I'm going to do a gentle massage in your ears. Let me know if it feels too much for you. You want the drops to go all the way in. That should do the trick. Let me just inspect one more time. Okay. Well, we're definitely have to go with another technique that takes a little bit longer, but it's gonna be better for your issue in particular. We're gonna have to recline you a bit in order to do the cleanup. Now, it's very common for my patients to take a little nap while we're doing it. It's totally fine if you do, to be honest. And sometimes even expected. That's when I know that I'm doing a very good job on relaxing my patients. Okay. So, I'm gonna be monitoring you, seeing if you're maybe falling asleep, you're feeling a little bit sleepy, because it's very important not to move during the cleaning. Okay, I'm gonna be working side to side, and I'm gonna be controlling your head, okay, in case that moves or swells a bit. Okay, very good. So now I just need you to stay put, try not to move, and just enjoy the process. Okay, I'm gonna be very silent during this process because it's a very delicate area and we don't want any issues happening in there. Okay, yeah, just start like that. Okay, good. Sorry to disturb you. How are you? Feeling relaxed? Okay, let me just take this off. We're not gonna need them anymore. I'm gonna be cleaning the area. There was some fallout here. Good. So we were able to remove any traces of earwax. There was no issues with ear infections or swollen ear walls, no problems with any other kind of issues there. It was just earwax that was being pushed in by the cotton swabs. Yeah, when we do the cotton swabs and we try to do it like this, we are only pushing it. When you see that, oh, it's coming something, so it's working. Yeah, you're taking something out, but you're mostly pushing everything in. So it's definitely not a very good idea to keep doing it, because then issues like this happen where it gets pushed all the way to the back. What's better? Well, let me show you something that is a good option. Tools like this, like a little spoon like this one. These are specialized tools to remove earwax. You scrap it, but it doesn't feel as great as as a cotton swab, but it's better for the ears, to be honest. Or with water irrigation, sometimes wax, burning candle wax helps quite a lot with the issue. Okay, so luckily we didn't find any medical issues in your ears. How is your hearing going? Notice a difference? See? Yeah, it was definitely that. So now I'm sure that you're gonna feel more relaxed, less stress that you were telling me about. And with time, you're gonna notice that your tinnitus maybe not going away, because it all depends on how you got it and how strong it is. But it's not gonna be as noticeable as it is right now with you. You tend to ignore it. It's like our nose. It's always there, but our brain just ignores us. And it happens the same with tinnitus. Okay, very good. So is there anything else that I can do for you today? No, it was my pleasure. Thank you so much for coming to our clinic. And if you ever need another cleanup, we're here to help. Well, it's definitely better to make an appointment, but as you see, you're walking and you were lucky. Sometimes people walking wait about between 30 to 40 minutes for an opening. So it's better to do an appointment. Okay, thank you so much for coming, and hope to see you again.